Hello and a very good afternoon to all of those joining me live on the Facebook page of News 9. I'm Neha. Now, ever since the outbreak of coronavirus pandemic, several countries have been taking stringent measures to control the spread of the highly contagious disease. Many countries, in fact, went into regressive lockdown to curb the spread and opened up gradually after the cases started coming down. But these very countries are now witnessing a second stage in coronavirus cases, second surge, beg your pardon, in coronavirus cases. Countries like England, France, Germany, Colombo have already implemented lockdowns again. In fact, Germany was appreciated over its handling of coronavirus pandemic in the initial stages. In India as well, we stepped into lockdown in early stages, but after the lockdown was relaxed, what we got to witness was a surge in coronavirus cases. There's no denying, of course, that lockdown helped in containing the spread, but at the same time, it failed to completely wipe out the virus, and this was known to us. Now, this leads to us to a very important question of how effective are lockdowns and what is the sole purpose of the move. To understand more about it, joining me live on the show is Dr. Vishal Rao. Many thanks, Dr. Rao, first of all, for taking out some time and speaking to News 9. My first question to you, Dr. Rao, would be, this is one of the most widely discussed topics, lockdown, and do they really help? In a certain way, of course. Now, we're witnessing a second wave in countries which were earlier applauded for their handling of the crisis and stepped into lockdown. Doesn't this kill the very purpose of stepping into lockdown in the first place? Because, countries stepped into lockdown to ramp up their health infrastructure and kind of deal with the situation we are now experiencing.
True, Neha. In fact, way back in March, we actually discussed this entire points both at government level and at various forums like the WHO and others, where we often emphasized on the fact that lockdowns is a way to prepare yourself. This is very important, that lockdowns is not a solution by itself. It actually helps you prepare, it helps you slow down the propagation of the virus, because in these conditions, we need to know that this is a socio-economic virus. The more you socially exchange, the more you run the economy, the more this virus is going to spread. So the reality is, this is a socio-economic virus, and this virus is going to spread if you do not control the socio-economic movements. Now, understanding that, lockdowns were proposed as a very good solution to reduce and slow down this approach, so that we can build a China wall between the positive and the negative cases. So lockdown is a period that you prepare. Now, typically we said that when we first, I would like to take you back to the first lockdown of the 3 weeks, where we actually had suggested at that time that the first week was to actually was important for the first week. If you divide the first 3 weeks, the trace, the test and the treat, we said that the first week should be to actually prepare for PPE kits, for testing, for medications and others. The second week was to do a rapid hunt down and identify all the positive cases and build a China wall between the positive and the negative. And the last week was to shift the emphasis on hospitals and equip hospitals with ventilators and others, so that we are ready for the opening of the lockdown. And I still believe that the same principles continue to hold today. Those 3-week formula that we talked about still holds good, that the more we open up, we are going to spread this entire virus, and eventually we will have to accept the fact that what are our learnings from the 1918 Spanish flu pandemic. With a crude fatality rate of 2.5, this particular Spanish flu pandemic, 100 years back, when the social status was 100 times lesser than what we are today, took about 2 crore lives in India. So considering that numbers.
Dr. Rao, this brings us to a very important question, which is like countries like Sweden did not really step into harsh lockdown. The number of cases which they got to witness initially, many countries are now seeing the same numbers even after the lockdown. So will you say that, was that the right approach in your view?
We've actually discussed this with various epidemiologists and researchers and public health experts. And in fact, I was talking about this to the Elsevier's team, which is a part of the Lancet Resource Center, who were the publishers, and they had a very interesting perspective on this, which they shared with me. They said the most important thing about understanding the Sweden model was that the Sweden model shifts its responsibilities on carefully looking at the citizens following the key rules of social distancing, mask, and hand hygiene. So from the very beginning, the Sweden model has been relying on herd immunity very, very carefully while taking care of its citizens following the rules of the game. Now, this largely depends on relying on the people and the citizens of that country to follow the rules amicably in a very strict and stringent manner. Such an approach wouldn't have been wise for India because considering one of the largest populations of the world, you may not achieve the same behavioral goals that Sweden would have achieved in the initial run. So the lockdown was required, but during that particular phase, we understood that it's not going to be easy to prepare for this pandemic.
Well, which brings me to my third question, and that is talking about India. We stepped into harshest lockdowns in the very early stages. Economic activities took a hit, and after relaxation, we are still witnessing an increase in the number of cases. What, according to you, have we really gained from the lockdown?
I think what we have gained from the lockdown, the most significant aspect that we have gained from the lockdown is preparation and also understanding. Now, preparation, I think, was a very important thing here because for a country like ours, where we have to scale up efforts of something like PCR, which is only done in the high-end diagnostic labs, to take it to the lowermost level of districts or PHCs would have been impossible without lockdowns. The aspects of understanding that how to create a complete management system, whether it is going to be handling the private sector or handling the beds, to looking at controlling the treatment patterns, ventilators, was something that we took more than longer to actually prepare for because our health infrastructures are not geared up for handling a pandemic. And that's why it's very important to understand that lockdowns by itself are not a solution. And Neha, here I would like to add one more point. I often say this: if I'm attacked and if I know karate, then I can naturally defend myself. But when I'm attacked, if I do not know karate, I cannot be watching a YouTube video and trying to defend myself when the person is standing next to me to attack me. This is very important. That's what we understood, that health infrastructure, health training, pandemic preparedness is very, very essential for our country for the future.
Right. Right. Many thanks, Dr. Vishal Rao, for joining us with all of those important inputs.